Good afternoon, and we'd like to welcome you today to the Flint Community Webinar on Coronavirus, November 5th, 2021. This is week 86. This webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, as well as the Prevention Research Center of Michigan. We certainly appreciate you joining us today. I am excited again to have the opportunity to be your moderator, Yvonne Lewis, the co-director of the Healthy Flint Research Coordinating Center. I'd like to again welcome you. We've spent these last 86 weeks addressing COVID and how it affected us as a local community, what the resources were. We wanted to bring to you a local context to a global pandemic. And over these last 86 weeks, we've also been addressing related and emerging community issues. So we want to thank our numerous partners who have joined us every week to help us share this information with you. And today, as always, many of them are here to help respond to questions that you might have. So we'll ask you early on as you are participating, whether you are actually in the webinar, you called, please give us a call or put your questions into the queue. If you are listening and you want to call us, give us a call at 810-835-2130 so that we can get your questions in, or please feel free to email us at info@hfrcc.org and we will make sure that we address the questions that you raise. Today, we have an exciting conversation that we'll have with you. We're going to be looking at the risk and benefits of vaccinations, COVID vaccinations in children. We'll have an update from the Genesee County Health Department. We'll also hear updates from the City of Flint. And we want to just highlight a couple of our partners today. Along with our partners, we want to appreciate those of you who listen every week and share with us your feedback. We are excited to hear that the information we're sharing is helping you share information with your family, friends, and other community members that you are in contact with. So again, your input is very valuable to us and helps us to continue to keep this webinar moving forward. So today we want to just begin by letting you know that Gary Jones, who is a representative from the governor's office, unable to be here with us today, but he wanted us to highlight and point out to you, please call him if you need specific information about what's going on in the governor's office at 517-282-3193. And certainly you want to get on his email list because you will get all of the updates. And you can email him at Jones, JONESG 9 at Michigan, spelled out MICHIGAN.gov. Again, that's Jones G 9 at Michigan.gov. In addition, you can go to his, as he says, the catch-all website for information around coronavirus at www.michigan.gov/coronavirus. So please be sure you get that information update from Gary Jones. Today, as we mentioned, we have some emerging conversations that we want to have with you and some follow-up from last week's conversation. I want to ask our panelists, Dr. Deborah Furholden, Dr. Lawrence Reynolds, and Dr. Pam Hackert. I see she's still trying to make sure she gets on with us today, but Dr. Furholden and Dr. Reynolds, just get us started with this conversation. There's been many questions about COVID vaccine. Vaccine, is it safe? Should we do it? What's going on right now in the world of COVID vaccinations? Dr. Reynolds, I see you got your mic off and you're ready to start.
Yes. Well, I'm shocked that folks are still asking the question, is COVID vaccine safe when hundreds of millions of people have received the vaccine and more have benefited, way more have benefited than those who have had problems. It's interesting, and I think we discussed this before. It's like someone ate a hot dog and then they got in their car and drove down the highway and had an auto accident. Someone says, well, eating is associated with auto accidents. No, that was a coincidence that probably would have happened whether they ate the hot dog or not, but they attribute it to eating the hot dog. So we have to be careful when we see stories that say A happened, then B happened. It does not mean they're related.
Well, Dr. Reynolds, I understand that, but how do we tease that out? What would you suggest to people that they consider if you don't want them to conflate or connect those two issues together?
Well, first of all, I'd ask them what their source was. From whom did they get that report? The second I'd ask them is, okay, this person told you this, and if it happened to them, did they report it to their physician? Did they report it to their health department? Did they report it to, there's a whole system called the Vaccine Adverse Event Reporting System. Sounds sophisticated, but you can just pick up the phone and call them or go to a website. And you can get that information because all the public health agencies and the Center for Disease Control and the FDA want to know about these things. So there are ways the credibility of these reports. And I'll go quickly to, let's say, the suspect reporting, where who was the rapper who said that the vaccine caused a friend of hers to be unable to have an erection on his honeymoon.
On that one,
Oh yes, oh yes. It was blasted all over the media a couple of say a month ago, and you have to think through these things, and you have to verify these sources. And you may have noticed this rapper was invited to talk directly to someone from the CDC, and I don't know where that discussion went. But sometimes people will just do things for publicity. What do you call it when you're on Facebook or Instagram and you have followers? Is that the term? As you increase your number of followers, because that blows you up. So you have to be real careful when you look at the source.
now, Dr. Deborah, we talk about looking at sources, and I know one of the things you do, you pay a lot of attention to information, where the information comes from, because you're an epidemiologist. You look closely at all of these things. So as we have so much, I call it misinformation, and it's really excitable. What do you say to help us really try to work through and tease through to get some good information?
Really recommend people to find their trusted sources of information. And unfortunately, I don't think it's TikTok or Facebook or, social media. And oftentimes I don't even believe it's, the things that you find in the media. I mean, we started this webinar and we got all of Flint and Genesee County's best and most committed and knowledgeable, for a reason. We wanted this to be a place where people knew they could get information. We direct people to the health department website. We direct people to specialty associations, right? So we had a lot of pregnant postpartum women or women who were thinking about becoming pregnant who had a bunch of questions about the vaccine. We directed them to the American College of Obstetrics and Gynecology website. Why? Because they had people digging down deep, looking at the data, pooling data from pregnant women who were getting vaccinated, et cetera. And they were out in front on that. Before we had information about safety for children, and we wanted to sort of have ways to think about it, we direct people to the American Pediatric Association. There are trusted and credible, sources of information. I do believe our local sources of information are going to be the best for people. We have a really great health department. That health department website has a lot of good information on it. I find it easy to navigate. I go in, I check it periodically, and I think like a layperson, somebody who doesn't know anything about anything, and I try to find a COVID testing site, or I try to find a place where I can go get a vaccine. And it's all very easy. Admittedly, it wasn't this way in the very beginning, right? We were literally changing the tires while the car was moving because we got, caught off guard. The whole world did, right? And so I just, encourage people, you got to filter out all of that nonsense. And just because somebody calls themselves doctor does not mean that they are qualified to give you information. I have been shocked. You got doctors of philosophy, doctors of sociology speaking medical nonsense about vaccine safety and effectiveness. And this is not the time to, sort of listen to the guy standing on the corner with the bullhorn. Go lean on those trusted, credible sources of information.
Thank you. And Dr. Reynolds, you mentioned something a minute ago, because we talked about this a little bit earlier in the call. There's a lot of messages out on TikTok. We do have Facebook, and people are boosting up to get friends, so they get followings because they get paid to have so many people follow them. And so it has become a business. And so really it's important, as you mentioned earlier, to talk to your pediatrician, talk to your physician, talk to somebody that you can trust. Research and science takes time. We're fortunate that we're in like real-time learning, but how important it is to hear from those who are involved in it directly.
And I might add to that, this is our first pandemic in 100 years. Yes, we got through the polio epidemic almost 50 years ago. And people don't remember it because many parents under 50. So we really have to understand that this is a new virus among humans. That's why they call it a novel virus, not like the book you read, but because it's new. It's never been seen before. And so we learn more every day. And so you really have to be careful to people when you talk to people who say, I know everything there is to know about coronavirus. Because no, we know what we know based on our experience now, but we're learning more every day so that we can inform people properly. And then there's another issue that Dr. Furholden and I know Dr. Hackert would speak to. There are valid public health tools and techniques that we have used for almost centuries when we respond to an epidemic or a pandemic, and they are still valid. And that's why we're always talking to you about vaccination. And I say it this way, is the foundation of prevention of infection. That's the foundation now that we have it available. And then there are those multiple layers of protection, wearing masks, maintaining social distancing, washing your hands, previous health activities. And as we've always said, another layer of protection is making sure you have accurate information.
So Dr. Reynolds and Dr. Deborah, at that point, we talk about risk and benefits of the vaccination. And it was mentioned earlier, Dr. Deborah, some weeks ago, you talked about the adverse event reporting. Can you just reiterate that to us again? Because we recognize that sometimes there are people based upon their health conditions that might have a reaction, or who, as you mentioned once before, Dr. Reynolds, they're not able to take the vaccination. So what should people do if they think they have a concern that the vaccination may have caused something? What should they do?
First of all, we ought to look at the common side effects. Side effects happen with medication. Side effects happen with alcohol. Side effects happen with vaccination. And there are common side effects. In the first 24 to 48 hours, that might be fever, ache, fatigue. Some people have headache, but these are temporary issues that will pass. And then when we look at what we call adverse events, yes, there has been a small number of people who, after vaccination, had a condition called myocarditis, which is an inflammation or irritation of the heart muscle that causes palpitations, weakness. You may recognize rapid breathing because the heart's working hard to pump the blood and the lungs are making you breathe faster to get more oxygen in. That is a adverse event, and we have found that it is more common in some populations, specifically males between 18 and 30. And we have to be cognizant of these things. We have to know this so that we can report it as an adverse event. And then I always go back to the same strategy. If you have a question, ask somebody. You can call your physician, you can call the health department, you can check the Center for Disease Control website, you can check the county and the state website. And like Dr. Deborah Furholden said, our county health department website is fantastic. And you should familiarize yourself with that so you know where to find what you want.
So for now, those of you that know individuals who can't do that, we want to just encourage you to help them along. Maybe you can print off a copy of information that's on the website and share it with them. And maybe you can look more closely at it. And if you have questions, please feel free to put those questions in the Q&A here today. Our team will be happy to answer it for you. And I see some of those questions being answered right now. Dr. Hackert has made it with us back. Come on, Dr. Hackert, can we hear you now?
I think so. Can you hear me?
I hear you now. We're talking
Great.
about, so one of
Right, I've been listening.
Okay.
So I raised my hand because, well, one, now I blurred Dr. Civil. So this is Dr. Yolyn Civil. She's a very experienced pediatrician who is also a friend of Dr. Wolford, and she is doing her preventive medicine and public health residency at the University of Michigan. So she's getting another board certification. So she's here with me as well. So I have her expertise, but I also wanted to just kind of touch on what Dr. Reynolds had said about the myocarditis being so rare with the vaccine. I'm sorry, I'm on my iPad, so it's really a bad angle. So so the thing to remember too is that this is very rare, but it's actually 1/6. So it's like less than 15% of what you would actually have as a risk if you got COVID infection. So myocarditis is 6 times higher in children who actually get COVID and get myocarditis from that than the people who are getting vaccinated. So by getting vaccinated, you're cutting your risk actually of getting myocarditis quite a bit, significantly.
Okay, so you are saying that that's a risk, but it's less of a risk from getting the vaccine than it is from actually getting the COVID virus itself.
Yes, 6 times less.
And I think that's something that we really want to help tease out to our listeners today is the risk and benefits. I know that, you know, we do hear a lot. Dr. Deborah's put in the queue here, the adverse events reporting system website. And I just want to, for those that cannot see it, it is VAERS.HHS.gov. So that's Vaccine Adverse Events Reporting System, just the first letters of that at HHS, which is Health and Human Services.gov. It is important that you report there because it helps give an overall sense of what's going on in the community. But if you could just talk a minute about the risk and the benefits, because it is a real challenge right now. We vaccinated a lot of the people that want to get vaccinated, but those individuals who still have questions, these are really important to have answered.
Well, one of the frustrating things I think with the way we report vaccine side effects or events in medicine in general for all vaccines or all studies even, is that you have these risks that are reported, whether it's a drug study or whether it's a vaccine study. But if you look at the other arm, so remember like a ideal study would be case control. So you have a control which receives the placebo, and then you have a group of people who are receiving the actual drug or vaccine being studied. They asked both groups, the placebo group who didn't get anything except something, you know, like a sugar pill or you know, vaccine of saline, and then they asked the people who received the actual thing being studied what their side effects are. And in many cases, including like these vaccines, that you'll find some of the side effects are almost as high, some are higher in the placebo group because of people either getting COVID or having a anxiety reaction. There's so many different reasons why you can have a really high side effect rate in the placebo group. But what you hear reported all the time, because this is the way we do it, we want to be upfront with all of it, is we tell what the side effects are for the vaccine or the drug that's being studied. But only when you get into the actual article that you see that placebo might have been higher. So I was looking at one of the new exciting treatments that they're considering, which is one of the antidepressants. An old antidepressant is showing some very good signals that it may be effective in preventing hospitalization or severe illness in those who have it already. And this study was a really good example of it, that they were having side effects higher in the placebo group than in the study group.
Okay, so the listeners, this is a question in the queue too. There are people who do have some concerns, and I want to kind of segue this so we can talk a little bit about parents who have concerns about getting their children vaccinated because of possible side effects. So we know that now the EUA, which is Emergency Use Authorization, has been approved for Pfizer vaccinations for children 5 and 11. And there are some concerns from parents. Should I get my child vaccinated, and what might some of the risk be with that? And I see you moving over to Dr. So please.
I just wanted to include her, and so I unblurred my background.
Sure.
So what might some of the risks be with the vaccine?
For children, because now, and we want parents to feel some confidence in getting their children vaccinated. What should they be considering?
Well, one, to remember that they are lowering the a dose of the active ingredient in these vaccines. It's 1/3 of what the adults would have. So it is something, a smaller dose for a smaller body. And then most of the side effects are the same as you would see in an adult. You know, tiredness is one of the biggest complaints. They may have a mild fever. They will, likely have a sore arm. But there's also, with the smaller dose, they also use a smaller needle, so it's not as big of a needle. Did you want to add anything? She's
one of the things with children and vaccines in general, you have to remember is that most kids really hate shots. And so the anxiety and symptoms associated with that is going to be much higher with children than with adults. So there's that aspect too.
Okay. But are there greater risk? I guess are there greater risks for children than for adults?
No.
Let's see, Dr. Reynolds wants to chime in on that one. Come on, Doc.
Let's talk about risks and benefits. You can't talk about risks without talking about benefits. So, and I'll put it out there. You have a house loaded, unlocked. You have a greater risk of somebody being harmed by that firearm. Well, consider COVID to be a locked and loaded gun in your house if you are unvaccinated and not following those protection instructions. And you have a greater risk of either harming yourself by getting infected or harming somebody else by transmitting the infection if you're carrying the virus and you don't have symptoms. And I've seen this happen even amongst my extended family. A little kid goes to preschool, he's fine. They get a call from the preschool and says, we have had a positive case you need to get your child tested. And he had already visited his grandparents and he passed on the infection to one of the grandparents. So it's like prevention is the key. And so don't go around with a locked and COVID exposure experience when you can prevent it with a vaccine.
Thank you, Dr. Reynolds. And I know as we begin to round out the round table here, I'm going to ask each one of you if you got a final comment. Maybe there was something that you wanted to share that you missed. But I do want to just ask our listeners, please put your questions in the queue. It does help. Those questions will be answered. And if we don't get to them today, we will definitely be answering them going forward. As Dr. Reynolds mentioned, this coronavirus 19 is different. It's not the first coronavirus, but this has created a worldwide epidemic. And now, as Dr. Deborah has told us, it's an endemic. It's going to be with us. What we can do now is to better prepare ourselves through learning and making good decisions that'll help us going forward. So I'm going to just do a quick round robin. Dr. Deborah, I'm going to start with you. You're on mute wonderfully. Just tell us.
Yeah. And you know what's crazy is when you start doing that, Zoom will pop up and say, you're muted. It sounds like you're trying to talk. You're muted. Lizzie has a great comment, and it says, if we're afraid of side effects, is it possible to find comfort in the fact that the possible side effects of vaccine are lower and lesser than the very real lasting effects of COVID and the very real symptoms of experiencing COVID? I think that is an absolutely brilliant comment. What people do not realize is, yeah, we hear a lot about people needing to go on ventilators, and people get really worried about that. You know, I've heard a lot about people not being able to really sleep at night because they can't catch their breath and they're afraid they won't wake up. But COVID impacts, has the capacity to impact every major, you know, function in your, the receptors that COVID binds to are everywhere, everywhere. I know people who had ended up on dialysis after COVID, people in our own community who were runners before COVID, who now are having problems with just like their normal regular breathing. You know, so I just ask people to weigh that out. The benefit of being vaccinated and what that provides you and your body as an opportunity to not have COVID just wreak havoc on your body is far outweighed than any possible minor side effects. And that very severe one that Dr. Reynolds talked about is very rare, but also very manageable. It won't sneak up on you. If you happen to be that 1 in a million person, you will have signals, you will have symptoms. We know exactly, people, they tell you that when you get your vaccine, what to look out for, what to do if this happens, and the medical community knows how to nip that in the bud. So the benefits far, far outweigh the risk and the consequence potentially of contracting COVID.
Thank you, Dr. Deborah. Dr. Hacker.
I would also just call to mind that children also can get long COVID. They may have the symptoms that show up even with an asymptomatic case. So people keep saying, well, they're asymptomatic, they don't have it. Well, they can get symptoms that show up, 3 to 6 weeks after they were sick with COVID that will show up. And often it's like a brain fog. It can be just general fatigue. Their general physical conditioning decreases. And we don't know how to treat that yet. And this is something that is avoidable with the vaccine. You do not get that. The vaccine side effects come and go. Even the children who do get that rare case of myocarditis, which I think is about like 400 cases out of 1 million, like it's very, very, very low. Even those children, though, like almost all of them recover within a few days of having that happen. And so this long COVID is really insidious, and it's showing, they're thinking it's about 10 to 15% of kids will get long COVID, and that can just really destroy a school year.
Thank you, Dr. Hacker. Dr. Reynolds, last word.
Yes, when I'm flying with my grandson, you'll hear the flight attendant say, when the oxygen mask, should it drop, your mask first and then put it on your child. And that's how we have to temper and handle our moods. See, our children read us like a book. We don't have to say something sometimes, and they pick up our anxiety and concern. So the challenge for us as parents and grandparents is to address those worries and concerns by getting the correct information. And I will say, as a parent or a grandparent, you will always worry about your children. But what you do is the best you can with what's available. And as soon as my grandsons reach the age of 5, they're getting vaccinated without hesitation. And that's most important to me. And I will be getting my booster. And I already got my flu shot. These are things that we can do because prevention is the key when we're dealing with infectious disease challenges.
Thank you so much, Dr. Reynolds. And one of the participants is asking about us giving updates for holiday season. We will definitely begin that next week because we are getting toward Thanksgiving and certainly Christmas and New Year's. And so we will be giving those updates on how to stay safe during the holidays. So thank you to our panel. We appreciate you. And because we talked about the risk and benefits, we want to know where opportunities are for us, should we choose to get the vaccination, and we know we need to get testing. So Sherelle's going to give us an update from the health department of where we can access both testing and vaccinations. Sherelle.
Good afternoon. Thank you for having me today. There's my contact information on the screen, and we can move on to the next slide. We are still making progress in Genesee County with vaccinations. We have about 47.4% of our entire population fully vaccinated at this time. Our goal is to go higher, and I think with the authorization of the children's vaccine, we'll be able to get that age group and raise our vaccination rates. Next slide. So yes, the Pfizer vaccine has been approved for ages 5 through 11. And next week, the health department will start administering pediatric doses, which is a third of the dose of Pfizer that an adult or teenager would receive to our youth. So that's something to look forward to, and hopefully we'll see a decrease in the spread of COVID in our schools. And as you all know, the health department is offering booster doses for Pfizer, Moderna, and J&J. Those have all been approved as of October 26th, and they are interchangeable. So you can come to any of our clinics and receive whichever vaccination you want as a booster dose. Next slide. So we do have our clinics coming up. Our 3 main clinics that are Tuesday, Wednesday, and Thursday are located at Our Lady of Guadalupe on Tuesday from 12 to 2 p.m. We have Moderna and Pfizer there. And then on Wednesdays at the Central Church of Nazarene from 10 to 12, we have Moderna, Pfizer, and Johnson & Johnson. And then Thursdays, we have a later clinic in the day at Shiloh Missionary Baptist Church from 3 to 6 p.m. Children are welcome at these clinics next week. We'll also implement other sites for the children to get their vaccination. As we know, they're in school during the day, so we don't want to take away from their education. So we'll have some evening clinics located at the local schools in Genesee County. So Tuesday, in conjunction with our Lady of Guadalupe, Grand Blanc High School will also allow us to serve the community there from 3:30 to 7 p.m. So we encourage you to bring your kids to get vaccinated in the evening. And then it looks like on Wednesday, in conjunction with Central Church of the Nazarene, we'll be at Flushing High School. And those appointments will start at 5 and go through 8 o'clock. They're not by appointment, they're by walk-in. So don't get confused with that. And then Friday next week, we will also be at EAJ, Mount Morris High School from 3:30 to 7 p.m. So we're trying to make the vaccines accessible to now our 5 through 11-year-olds and anyone who have not received their vaccine yet. Next slide. And that following week, we'll have our standing clinics Tuesday, Wednesday, and Thursday. And then we'll have an additional clinic that Friday at Lake Fenton High School from 11:30 a.m. to 5 o'clock p.m. And it's not on this presentation, but Sunday we'll be at Central Church of the Nazarene, not this Sunday, but the following Sunday over the weekend. And we'll also throw in a weekend clinic so that we can get as many children vaccinated as we can. Next slide. And of course, it's always important that we continue getting our tests for COVID-19. If you've been in contact with someone who has tested positive, it's good to wait at least 3 days before you get your test. And it's always great to check again by retesting. So on the screen, I have some locations where you can go within the community. We have Word of Life Church, Bethel United Methodist Church, as well as Macedonia Baptist Church. These 3 sites also carry the Pfizer vaccine as well. So you can take your children there to be vaccinated, and you can also get your vaccine there as well. And then you can visit one of the local Walgreens or Rite Aid in Genesee County for testing, or our Hamilton Community Health Network clinic. And lastly, we want you to know that we are here for our homebound population. So if you have a family, friend, or loved one who cannot come to any of our walk-in clinics, we encourage you to reach out to the Genesee County Health Department. You can call us at 810-344-4800 to get on the list, and we'll come to your home and serve you. And if someone is available in the household or the patient themselves, you can schedule online at www.gchd.us/vaccine scheduler/ to set up an at-home vaccination. And I just want to stress to our parents, it is a scary time, and I know you have a lot of questions, and the Genesee County Health Department is here to answer those questions. So please call us, because we want to be able to give you informed decisions so that you can make healthy choices for your family.
Thank you, Sherelle. And while we're here in the health department, there is a question in the queue. I see Dr. Reynolds is asking it, but I also want to ask Dr. Hackard if she can come back and just respond again to mixing the vaccine brands. Since there is opportunity at these local sites for both of the vaccines, can you give us just a quick, again, reminder of what you shared before about mixing the brands for the booster and the third dose?
Yes, and then I also want to touch on the testing center, so don't let me forget that part. So regarding mixing the brands, if you've received the Johnson & Johnson as a first dose, it was a noble effort to try and meet the needs of a community, one where you could have more stable vaccines. It didn't need to be refrigerated, the deep freeze at the beginning like the other ones. And also a one dose is so much more convenient when it's a family and or unusual work schedule hours. And so it was a good thing to try. However, they are finding that it does need the second shot. And so with the Johnson & Johnson, you can get the booster shot after 2 months, anyone age 18 and up, with no other restrictions. And it is showing that it's still very preliminary data, but it's showing that if you get the Johnson & Johnson with an mRNA vaccine, which would be either Pfizer or Moderna now, it's going to bring you right up to the, really great protection as if you had the higher level of protection from the 2-dose series originally. So I would encourage that those people who did have Johnson & Johnson, this is personal, this is, like my personal advice, this is not something you're going to necessarily read if you go to other sources, but when you look at the data is supportive of Johnson & Johnson getting an Pfizer or Moderna as the booster. Between, if you had this first series of Moderna or Pfizer, between getting a booster with either of those, it's there's some evidence of showing one's maybe having a little bit of a benefit over the other. There really is not much showing yet. So feel free to get either one of those that you wish. As Dr. Reynolds had said, the myocarditis in the younger men was associated with the Pfizer vaccine. And, so that would just be one very tiny, consideration to do. But either one is going to boost you up to a really great level, and highly encouraged. If I can go back to the testing centers, because I just don't want to forget, is a shout out to the sponsored ones that we have in the community, the Word of Life, Bethel United Methodist, Macedonia Baptist. Those you can get the PCR or you can get the antigen. You just have to ask which one you want. They may, offer you the antigen, which tends to be a little faster, but sometimes you want the PCR for a certain return to work or other kind of thing that is recommended. And so you can just ask to get that. You can get both. If you get there in the morning, like say before 10:30 in the morning, usually you'll have your results even for the PCR back by the following evening. I've had some people who have gone to Rite Aids or Walgreens and their PCR tests aren't coming back for 3 to 5 days. So just a little bit of a, a plug for the free community testing sites here. Also, I do strongly encourage people to get that extra testing. I know Dr. Reynolds spoke about it last time with, if you've traveled, if you've had out of town guests, if you've been in a crowded area, a sporting event and it's outside, so you may have felt, like you could go ahead and take that off and then somebody started coughing near you. Please, please, please go get those tests. They're very quick. They are very painless now. They aren't the kind that, used to go up to your brain, and get those testing, because we're seeing our positivity rates way too high right now, which means we're not doing enough testing to really find all the cases in the community.
Thank you, Dr. Hackett. And I do support our community sites. I've gone to each one of them and they're very, very professional. And last week when I went on Saturday to Macedonia, almost before, just a few minutes after we left, we were getting our results back. And then the following day, I did them both. So I encourage you to get the testing done, because it's for your own peace of mind, first of all, and then to help us be sure about what's happening in our community. So thank you so much for that. Dr. Deborah, the policy brief and the updates that you've been given regarding equity has been so very valuable to us. So we're going to ask you to come back and give us all those wonderful updates that you, some of which you couldn't provide last week because we were going so fast. But
yeah,
really, there are some good things I think you want to share with us.
Yeah, so we got some good news, which is that we continue to monitor and track everything, and we know the what's so. That's the good news. I say knowledge is power, and we know what's so. And I really want to acknowledge our tremendous partners at the Genesee County Health Department, because without them, none of this would be possible. So I'm just really grateful for Dr. Hackett and her team. So, we've started to become a little bit more specific in how we break these numbers down for people. Found, everybody knows this is Mary Catherine Crawford's baby here, this health equity brief. She said, I want to get the word out to people every week. And I also want to, she really wants to hold all of our policymakers' feet to the fire. So one of the things that we figured out is we would report the numbers every week, right? So we are reporting the numbers from the end of the week last week. But that's what happens. After that, we report those numbers, additional cases will come in, because you might have taken your test, your result might not have come back, or your result might not have made it into a central database until a week or two later. So we thought, well, I don't want to, I don't feel like you can change the past. We already told people these were the numbers for the week. But the way COVID cases get counted is you don't want to count them when the data comes in. You want to count them when they were actually a case. So it's important that people be counted when their test was positive. You don't count them when the test comes back. You have to put them in the week when that positive test result was achieved. Not the test came back, but when they actually took the test, because that's when they were positive. 2 weeks later, those people are likely COVID negative, right? So what we've done is we call those lag cases. Those are the cases that come in after the counts for the week have closed out. We go back and we add them on. So week to week, it's not an apples to apples comparison if we're looking at the lag cases, because guess what? We don't have the lag cases for this week. That number will continue to grow in the future weeks. So if you just compare what we call confirmed cases, what we knew at the time last week versus what we know right now this week, we are almost at a dead heat. The cases decreased just a pinch in Genesee County. They went down from 719 confirmed cases last week. This week we are at 705. You see there was some additional lag cases that got brought in. That's a 52, I believe, last week. So 52 additional cases got added. We don't know how many additional lag cases will get added this week. We'll know that in the weeks to come, and we'll be reporting out on that. Confirmed cases in Flint increased slightly from 139 to 142. We have something in public health and in epidemiology called statistical significance, right? So people will oftentimes, and I would love for all of you to be many researchers and able to look at things and scrutinize them. When somebody says, oh, it increased, you want to know, was that increase significant? The difference between 139 and 142 statistically is they're not different numbers. They're very, it's like, you lose 1 pound, you can lose or gain 1 pound with a good, McDonald's Big Mac or something. So it's not a significant change. So basically we're kind of almost like at a dead heat, even right now with the numbers. Race is still unknown for many of our cases. And I really appreciate and want to acknowledge our analyst, Alan Harris, who works with Dr. Sadler. And I said, we've got so many unknown race cases, that red bar here on this graph. And you'll notice we now have in many weeks, more cases where the race is unknown for different reasons. Sometimes it's that it's not asked, sometimes it's asked and it gets lost in between the lab and going back to the database. Sometimes that gap is backfilled and somebody will come in afterwards and fill it out. So we might ultimately be able to get that data, but not having it in real time left us with the question, have we continued to have that benefit of closing the racial disparities gap? And as we were talking about it as a team, Alan, I guess the data guy in him said, I'm gonna answer that question. So what he did is he looked at the geographic regions where those unknown race cases are coming from. And what he found is that the majority of those missing race data cases are in predominantly white cities and townships within Genesee County, suggesting that likely the racial disparities are not reemerging. So we would surmise then that the missing race cases, that they either will be similar to the distribution of the cases where we know the race, or it's likely that they're probably even disproportionately white in that category, since they're coming from predominantly white communities. And again, I want to be super clear. We don't want anybody to get COVID. We don't want anybody to get COVID. So this issue around disparities is not having any one group thicker or only having one get better. What we really want to do is bring this whole thing to a close and keep all of our citizens safe. But it is important that we monitor and make sure that our most vulnerable, whether it be based on race, ethnicity, whether it be based on your household income, your insurance status, your employment status, any of those factors, that no one group is being hit harder, because if they are, we owe it to them to have some targeted effort to ensure that that they're safe. So testing positivity rate, that's that good measure. How of the people getting tested, how many of them came back positive? It increased slightly from 15 to 17%. I'll just tell you, those numbers are really high. 15% is high, 17% is high. What that sort of screams out to me is people are not getting tested just periodically. A lot of times when the numbers are that high, it's because people are only getting tested when they have some symptoms or known exposure. So that number is pretty high, right? It's about just under 1 in 5. And so my recommendation for people there is get tested. You don't have to have symptoms. You don't have to have a known exposure to get tested. If you've been going to work every day or 3 times a week, if you are just out in public, if you've recently traveled, get tested. The testing sites are there. The testing is available. And the best thing you can do if you are COVID positive is find out very early on and get yourself in isolation so you can be taken care of, your staff, most importantly, so that you don't infect anybody else, including your vulnerable loved ones and other vulnerable members in our community. Geographically, what we see is, in general, the cases increased from last month to this month. So you can see the deeper the blue color, the greater the number of cases. And unfortunately, nationally, we saw a decrease in COVID cases across the nation from September to October. That is not the case for the state of Michigan. It is not the case for Genesee County. I believe it's all but one jurisdiction had an increase in the number of COVID cases. And again, our wonderful team does this once a month. They break down the case rate by municipality so people can see where we are having the biggest increases. This is important because if you only look at the number, it would give you the false impression that some places are worse off than they are. So if you are talking about a place that has 100 people and they have 10 cases, and you're comparing that to a place that has 20 people and they have 10 cases, that's a very different 10 cases. That's 10% over here versus 50% over here. So we like to look at the rate. How many cases are there as a function of how many people there are in the community? That gives us a more unbiased and balanced picture of what's happening. When we look at it that way, what we actually see is the city of Flint has the second lowest case rate, COVID case rate of all of the municipalities for both September and October. Unfortunately, like many of the other places, our case rate has increased from September to October. September is that yellow line, October is that green one. You see here in Fenton, they're the one municipality where that number went down. They have fewer cases in October, a lower case rate, which means fewer cases for them also in October than in September. But everywhere else it's going up. And in some places it's a 2 to 3-fold difference. You can see in Mount Morris, it's a more than 3-fold difference. And that's the case in a few places. It's a 2-fold difference, for example, in Forest Township and in Swartz Creek. So, you know, we just got to tighten up. The numbers, you know, tell the story, and these things are going in the wrong direction.
Wow, thank you, Dr. Deb. That was a good epidemiology lesson for us.
Yeah.
Really breaking that down so we can see how this is really impacting and what the numbers really mean, because otherwise we just hear them and it isn't really clear if that's a good thing or a bad thing. But what we can do to make a difference, first of all, is I think you're saying we all need to think about getting tested on a regular basis to ensure that we know exactly what's going on in our community. Thank you so much for that. I know Mary Catherine has some more good news for us, or interesting news, I should say.
Yeah, so I'm going to first build off what Sherelle had mentioned about the smaller dose for the pediatric vaccine as compared to the vaccine for adults. And so the only difference there is that the childhood vaccine is actually delivering 10 micrograms of mRNA versus 30 micrograms of mRNA, which is what adults receive. And then I just want to expand on the numbers a little bit, because this expands eligibility. The EAU expands eligibility to more than 28 million children in the United States. 825,000 of those children are in Michigan. And Governor Whitmer has already pre-ordered nearly just under like 300,000 doses. Which as you heard are going to our health department and other areas are going to be getting that administration underway quite soon. So very exciting news, but unfortunately right now I do want to provide a policy update about what's kind of going on, right? Because it's great news that we are expanding eligibility of the vaccine to children, but unfortunately there's a lot of effort in the legislature to stop this from happening. So last week, a partisan package of bills were advanced to the House of Representatives, and every single one of them seeks to limit the authorities of school districts, the state health department, and local health departments to implement and adopt emergency orders when there are public health crises. So this is specifically pertains to the ability to mandate or require masks and vaccines in schools. What's interesting is that there is currently no effort to actually mandate the vaccines for children. There's no legislation for that right now. There's not likely to be, except the federal mandates that we've seen come down. So that's why I really wanted to talk about what these bills do. So one of the four would actually require that schools with mask mandates allow parents to opt out of wearing them for their child. And this would just be based on, it doesn't have to be, it's not limited to religious or medical convictions, which are two waivers that we have in the state of Michigan that parents can opt out of authorized vaccines. And one of the really concerning things is that another one of the bills is very vague. It bars schools from requiring students to get vaccines that are approved with EAU, those authorizations, which I think it's really important for people to understand. These are not designations that the FDA takes lightly. And the language is not specific to just the COVID vaccine, which really creates a slippery slope for emergencies in the future. And the third and fourth bills that were part of this package are the ones pertaining to MDHHS and our local health departments. And that would bar them from enforcing rules for face masks, to require emergency use vaccines, and testing of asymptomatic students as a condition of attending school. Or school functions, which again is super concerning as we continue to see the positivity rate increase, and that we know infection is spreading among youths, right? And as we attempt to get them vaccinated. So we want policymakers to just ensure that our leaders have the ability to actually make these decisions in consultation with health experts, rather than just have these decisions legislated by people who are not public health experts. So yeah, we'll most likely see this this package of bills vetoed based on other actions that we've seen by Governor Whitmer in the past.
Thank you so much, Mary Catherine. Appreciate that update. And we have a quick update from the city of Flint. The staff was not able to be on with us, but we appreciate Kiana for giving us a quick update of what's going on in the city of Flint. They're very excited to announce to us that there has been a SBA loan approved for the city of Flint, and there is a website that you'll be able to go to, and you'll see that shortly. As a website you'll be able to go to learn more about the SBA loan that is available to us in the community. We also want to let you know that there was a new mini center opened up this week. And last week, police department welcomed residents and families to a newly renovated mini station on Bishop and ML King for the Harvest Fest on October 31st. They completed the successful trial run of the food trucks on Sundays, and that will begin again in spring of 2022. And many of you may know across the city, there are a number of open positions, and you are encouraged to go to the City of Flint website to apply for some of those positions that are open and available to you. As we also continue our session today, we want to remind you that on the 19th of this month, during our webinar time, starting at 9 a.m., I should say, the symposium, the annual Flint, Healthy Flint Research Coordinating Center's annual symposium will begin at 9 a.m. on this is October, and I'm in the wrong month again. This is November. It will be Friday, November 19th from 9 a.m. to noon. We're asking you now to consider registering for this. We will be continuing to talk about COVID information, but particularly building on partnerships, capacity building, and advancing health equity. So please continue to look forward to additional information about this, but you can register now for both the research symposium as well as the HFRCC research seminar that will follow the webinar on the 19th from 1 to 2 p.m. There's also an opportunity for you to nominate. Every year we have had an opportunity for you to nominate individuals that you think are making a difference in our community as it relates to research. And so we want to encourage you, when you go onto the HFRCC website, look for opportunities to nominate community partners, academic partners that have made a difference in our community over the last year. Today, we want to encourage you again, our community health workers, as well as our social workers, apply for the contact hours and the continuing education unit so that you can get the actual units that you need to continue in your profession. It is almost 1 o'clock, and every week we want to thank you for participating in this webinar. Your voice counts. Again, there's this for the annual research symposium. We want to go on and encourage you to look into that and make your nominations for someone who is making a difference. I want to thank you again for joining us today. You can continue to like us on Facebook. We appreciate you going to www.facebook.com HFRCC and liking us there and seeing more about what we're doing. Subscribe to the YouTube channel at Healthy Flint. And then, of course, email us at any time at info@hfrcc.org. Call us at 810-835-2130 for more information. Stay connected, and we look forward to seeing you next week. Thank you again for joining us today.